Governor, thanks so much for coming in today. Just a number of questions that we wanted to talk to you about ahead of, obviously, the May 22nd primary. My first question for you is pretty simple, and that is, why do you want to serve a second term as Arkansas's governor?
Because I believe in Arkansas and I believe in our future. We've had a great last 3.5 years, accomplished a great deal, but there's so much more to do in terms of competitive income tax rate, growing our economy, improving education, and we've laid such a great foundation. I'm excited about the opportunities for this incredible state and continuing to serve.
Okay. And my next question is, you know, obviously the budget has been a big concern, and you've gotten a lot of criticism from both sides of the aisle about being a financial conservative, but then the budget obviously growing under your administration. What is your response to that criticism, and how will you balance the budget but also the future needs of Arkansas?
Well, I would answer it by asking people to think about it. You know, Texas grew their budget, Tennessee grew their budget under very conservative leadership. And why is that the case? Because you have increased needs and you have a growing state. In Arkansas, we're a growing state, and so, for example, we've given 2 pay increases since I've been governor to teachers. I think that's a good call, but it costs money to do that. We've built a $50 million prison, additional space, because public safety is important. You don't want violent criminals out on the streets. And so you have to make these kind of investments in education, health care, but what they don't tell you is that we have a lower increase in state government spending than in previous administrations. And so we're holding the line. We've given over $150 million of income tax cuts, and we've created a reserve fund that has $120 million in it. So it's very conservative budgeting. We have 1,000 fewer employees in state government, so very proud of that record. But we're a growing state, and in education, we want to fund it. We don't want to have 4-day-a-week schools like other states have had to go to, or teachers on strike. And so those are responsibilities we have that the other side seems to ignore.
Okay. And question number 3 is that recent reports and studies have found that legalizing marijuana could have an impact on the opioid epidemic, seemingly how many opioids are prescribed. Do you think your position could possibly change on legalizing marijuana if those studies are found to be consistent?
Well, I'm a little skeptical about those studies. It's pretty anecdotal right now, but it's something you want to continue to look at. But the main thing that we want to do in Arkansas is to, one, implement the medical marijuana initiative that the people voted in. That's important and a responsibility to carry out. Secondly, to me, there's a bright line. I don't want to go to a recreational use state. People say, well, it'll bring in more tax revenues. Well, the cost would be significant, and so that's not the right path for Arkansas. When it comes to opioid addiction, this is a serious problem that we're addressing in a number of different ways, from our prescription drug monitoring program to more teaching tools for our physicians on prescribing guidelines, as well as our drug take-back programs and responsibility for parents and patients to make sure opioids do not get on the street. And so I think you've got to separate those issues right now. Obviously, any leader is open to good studies, and we'll look at any scientific study that comes in, and you rethink issues as you need to, but that's where I believe we are right now.
Okay. And my next question for you is that you've campaigned on a pro-life platform. How have you and how will you balance your conservative values with also the rights of women if you're given a second term?
Well, I think women very much support the pro-life positions of making sure that abortion is limited in its use and application in Arkansas, and I believe in a pro-life position. There's exceptions abortion for the life of the mother or in cases of rape and incest. I think that has vast support among women and men in Arkansas. Obviously, when you come to reproductive health, when it comes to family planning services, you want that available, and we have that available. Sometimes people say, well, we defunded Planned Parenthood, which we did in Arkansas, but there's ample other providers there that can provide those family planning services.
Okay. And my last question for you is that Arkansas Works and Medicaid are programs that have faced a lot of issues in the last few years, and they're likely going to need help from Washington in the future. Do you have any concern that the majority in Congress could flip and that could put those efforts that you've laid out in jeopardy? And what do you have planned for Arkansas Works and Medicaid?
Well, I would support change in Washington, and if they can repeal the Affordable Care Act, if they can replace it with something that gives the states more flexibility, I'm all for it. And so I'm for change in Washington, but I don't think they're anywhere close to that right now. And so we're getting the flexibility from the Trump administration. President Trump has been very supportive of more flexibility to states. That's why we have the reform in place. We'll be the first state to implement a work requirement for those on Medicaid that are able-bodied and able to work and don't have health impediments or minor children at home. We will continue to reform and look for more flexibility from Washington. And that way we can increase the access for health coverage, help our rural hospitals and those in need out there, but at the same time do a program that's affordable for the state of Arkansas.
All right. Governor Hutchinson, thanks so much for coming in today.
Thank you.
Appreciate you.